XDEMVY, lotilaner ophthalmic solution 0.25%, is indicated for the treatment of Demodex blepharitis.
Hi, my name is Vivian. I have dealt with an eyelid irritation and swelling for a long time. At first, I thought it might be allergies. I thought I'm going to have to deal with the eyelid issue for the rest of my life, and I didn't know there was a target treatment out there that could help me. It wasn't until I visited my eye doctor that I finally understood what's going on with my eyelids. My eye doctor immediately knew what I was experiencing. They explained that I have Demodex blepharitis, also known as DB, an eyelid disease caused by an outgrowth of tiny Demodex mites on my eyelashes. These Demodex mites were throwing a mite party on my eyelids. It was reassuring to hear that DB is a common eyelid disease not caused by a poor eyelid hygiene, and there is an eye drop treatment for it. My eye doctor prescribed me XDEMVY, the first and the only FDA-approved treatment designed to target and kill the Demodex mite that's called DB.
XDEMVY is the only FDA-approved treatment that targets and kills the Demodex mites that cause Demodex blepharitis. The most common side effect in clinical trials was stinging and burning in 10% of patients. Administer 1 drop in each eye twice daily, approximately 12 hours apart for 6 weeks. It is important to take XDEMVY for the entire 6 weeks. XDEMVY is available by prescription only. Individual results may vary.
I noticed a difference when I started using XDEMVY. After completing the 6-week treatment, my eyelid redness and crusty was reduced. By the time I went back for my follow-up appointment, I was amazed at the result, and so was my eye doctor. Now my eyelids feel more comfortable, and I continue to take care of my eyelid health. XDEMVY makes a difference for me. I would recommend it for anyone dealing with DB. If you're dealing with eyelid redness, crusty on your eyelashes, or irritation, talk to your eye doctor to see if you might have Demodex blepharitis. If you have DP, ask your eye doctor if XDEMVY is right for you. Party is over!
Indications and usage. XDEMVY, lotilaner ophthalmic solution 0.25%, is indicated for the treatment of Demodex blepharitis. Important safety information. Most common side effects. The most common side effect in clinical trials was stinging and burning in 10% of patients. Other side effects in less than 2% of patients were chalazion hordeolum and punctate keratitis. Handling the container. Avoid allowing the tip of the dispensing container to contact the eye, surrounding structures, fingers, or any other surface in order to minimize contamination of the solution. Serious damage to the eye and subsequent loss of vision may result from using contaminated solutions. When to seek physician advice. Immediately seek a physician's advice concerning the continued use of XDEMVY if you develop an intercurrent ocular condition, for example, trauma or infection, have ocular surgery, or develop any ocular reactions, particularly conjunctivitis and eyelid reactions. Use with contact lenses. XDEMVY contains potassium sorbate, which may discolor soft contact lenses. Contact lenses should be removed prior to installation of XDEMVY and may be reinserted 15 minutes following its administration. To report suspected adverse reactions, contact Tarsus Pharmaceuticals at 1-888-421-4002 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information at xdemvy.com by prescription only.